on Lifetime Live. Forgetting things lately? This could be the day you finally stop. We're going to give you a total memory workout. Also, Britney Spears and NSYNC are hot on stage. We'll meet the guy behind their smooth moves. And liposuction. It's not just for your hips and thighs anymore. It's moving on up the body. We'll show you.
From Lifetime Television and ABC News with your hosts Deborah Roberts and Dana Reeve. This is your Lifetime Live.
Hi, everybody.
Well, hello. We're in sync about this. Speaking of in sync,
Right.
We're so happy that you could join us today. Glad you remembered to join us today. I'm Deborah Roberts.
And I'm Dana Reeve. And today we've got a lot of stuff in store. We have, as you saw, a great choreographer with us today, Darren Henson, who choreographs for NSYNC and Britney Spears, and last night won an MTV Video Award for his work.
And I'm hoping that that means he can help me because, Lord knows, I have to say I'm an embarrassment to the Roberts family because my moves are not that smooth.
We'll say later. We also have a memory specialist who's joining us today. She's going to help improve our memories and hopefully help improve your memory as well.
That's right. And then also Jamie Lee Curtis is going to be here. You know her as an actress, but she's also an award-winning or a best-selling author. Not
For children's books. Yes, for children's books. And they are really wonderful. I know Leela's a little young for them now, but definitely get her books.
But probably not. I mean, I was looking through the one that she has today, and it's just beautifully done.
Yeah,
Leela loves these kinds of books.
They're all wonderful, and they're great fun for adults to read, too. And she's just terrific, and she's going to be with us today. And Bobby Rivers is with us here also. And so there are 3 new movies that open today, Nurse Betty, The Watcher, and The Way of the Gun. So I always love to hear what he has to say.
I know, me too. Bobby is our guy. Well, it's all coming up on Lifetime Live, the program by, for, and about women. But first, what women are talking about. And also, we're going to come up later on in the program with some medical information, liposuction in some unusual places.
Return a gain in the neck with liposuction, and later a test we can all take to improve our memory. So don't forget to stay with us. Thanks.
Liposuction is the most popular form of plastic surgery in the country. Most people use it to flatten their stomachs, to trim their thighs, but now it's being used for other parts of the body, including the one area that they say always seems to give away your age, as this New York woman discovered. And a warning, some of the images you will see are a little graphic.
I could probably stand to lose 15 pounds, but dieting is just really hard with lifestyle the way it is today. I mean, you got 2 screaming kids, and you can't even sit down and have a bowl of Raisin Bran. It's like I got to eat a Pop-Tart because that's all I could do when I'm running around after 2 kids. My face has gotten a little rounder, and if you look from the side, you know, you've got a little, as they say on Ally McBeal, waddle here.
So 35-year-old Allison Cook, an orthodontist, went to a plastic surgeon who recommended liposuction on her neck.
The real key here is the age of the patient. The younger the patient is, the better they do, because you're expecting the skin to contract with its own elasticity. We usually get good results up into the early 40s.
Dr. Sherman did a facelift on my mother about 6 weeks ago, and she looks absolutely fabulous. And I came in, and he said, oh, you know what, let me do a little lipo on your neck. It'll take 10 minutes. It'll make you look 10 years younger.
What we're basically going to do is just address this little fullness over here. And on Allison's, it's mostly low, below the chin. So we're going to mark a little tiny incision we're going to make right behind the crease so it's not visible. And we'll make the second incision right behind the earlobe so no one can see it.
Dr. Sherman performed the surgery in an operating room in his office after first giving Allison general anesthesia for the pain. He then inserted a small hollow tube or cannula through one of her 3 incisions and literally vacuumed away the unwanted fat in just minutes.
15 cc's, 20 cc's, tops. It's not a lot. And this little incision is right in the crease behind the chin. So it'll be totally inconspicuous. Last stitch for him. And that was the last stitch. And with perfect timing, Allison is now awake and the operation is over. We're going to put a little tiny dressing on. You did wonderfully. You got a skinny neck now. And you can see here the contour, actually, is pretty dramatic. It's nice and flat. This is before the swelling is going to start.
10 minutes and $2,000 later.
I'll be excited to see. Probably won't look too good for another couple of days, but I think 2 weeks will look really good. It's getting there. Just a little more swelling right here.
2 weeks to the day, and Allison is pleased with the result.
Everybody who doesn't know my secret yet says, oh, you look like you lost a little more weight. but it definitely feels tighter. And, you know, I guess more from the front you could kind of see the point of the chin where before it was more rounded.
Dr. Sherman says liposuction can even change the way you feel about exercise and jumpstart a weight loss program.
Sometimes a simple 15, 20, 25-minute operation like this gives them enough incentive to get to the other part. This is very non-invasive, it's very simple, it's very predictable. We get a controlled result. They look in the mirror and suddenly they say, this is great. And it might just give them enough incentive to get past that psychological hump, which is really tough to start sometimes.
But Allison isn't heading to the gym anytime soon. By the way, she's so thrilled with her new profile, she's now thinking of having liposuction elsewhere on her body.
I'm seriously considering a liposuction for my stomach. I'd like to get back the curves that I had before my sons were born, and it's hard to maintain that physique as you get older.
Well, liposuction may not be for everyone, and there are some risks involved. So joining us now to talk about it is Dr. Darrick Antell, a plastic surgeon here in New York who has performed plenty of the procedures. Dr. Antell, welcome.
Thank you. Thank you very much.
In all fairness to Allison, I mean, you know, obviously it was something she wanted to do, but you can't help but notice that she doesn't have a huge difference there. I mean, will there be more of a difference later on?
Her case, it was actually more of a modest improvement. There are patients where it's really much more dramatic, but don't lose sight of the fact that it's only 2 weeks afterwards that picture was shown. I think you'll see that in about 2 months afterwards there'll be a more dramatic improvement.
Now, she herself said that she probably could stand just to lose about 15 pounds. I mean, isn't liposuction a little drastic for somebody like that who probably could just lose the weight?
Well, liposuction is not designed for weight loss. It's really designed for contour irregularities. I've seen a Sports Illustrated swimsuit model in my practice for liposuction and professional athletes that have certain areas that they just can't get rid of.
Now, what about the risks involved? Because we've all heard a few horror stories every now and again about somebody who went in for something simple as liposuction and didn't make it out. What are the risks that are involved?
There are actually significant risks, and I think the most important part of getting a good result from the operation is the surgeon that you choose. Many people spend more time picking a toaster oven. It's critical that you investigate the credentials of the doctor.
What about pain? Because a lot of us in the studio were going as we watched that motion to take the fat out. Is it painful?
It actually is not that uncomfortable of an operation for the particular operation that we watched. I think that if liposuction is done on larger surface areas, other parts of the body, there can be more discomfort, but most people within 2 or 3 days feel fine. They're taking showers already and doing pretty much most normal things.
Now, there were some people here in the office today who talked about other people they've known who've had it done, who maybe gained weight back and had like a waffle look. What happens there? Is there something that happens with the fat cells and the redepositing?
People ask me that question a lot, and I don't think that extra fat comes back in another area. What happens is I think if you look critically at their before photos, those areas may have had that waffling or that problem before, but they become more aware of it after the surgery because you've corrected the problem that bothered them first.
And the idea of doing it in the neck now, that's a fairly new procedure.
Well, it is, and it's particularly useful for younger patients who may not be quite ready to have a neck lift or a facelift.
Is it more of a psychological boost? I mean, the doctor in this piece said that it sort of jumpstarts a lot of people to move on with other areas in their lives to improve.
I've seen dramatic improvements in people's attitude after plastic surgery. It gives them an uplifting feeling about themselves. You know, if you have a nice blouse on and you feel good about yourself, you just feel like conquering the world, and that's what plastic surgery does. It improves your confidence level.
Interesting. All right. Well, Dr. Darrick Antell, we appreciate you being with us today.